that you'll hear more about today. Some of our work is focused around developmental evaluation centers for autism, pediatric trauma, response centers for child abuse, and other things throughout our history as the South Carolina Children's Hospital Collaborative. That collaborative is made up of the state's 4 children's hospitals: MUSC in Charleston, Palmetto Prisma Health, Greenville, in the upstate, Prisma Health Midlands Children's Hospital here, and McLeod's Children's Hospital in Florence. We fully endorse this report that is going to be presented today, and the 3 children's hospitals that provide treatment for cancer, MUSC, Prisma Health Children's Hospital Greenville, and our Prisma Health Children's Hospital Cancer Program today, fully will support it and work together and use its information for the betterment of South Carolina's children with cancer. But we cannot do that alone. And so today's report is a collaborative effort, and our efforts will need to be that of collaboration. Collaboration is always necessary for the betterment of South Carolina's children. And I think we have shown in our collaborative nature with this report, our work as South Carolina's Children's Hospital Collaboratives, and our independent work as children's hospitals, the power and the success that collaboration can bring. So I know today's report will be a springboard for all of us to help South Carolina's children with cancer. So again, I welcome you on behalf of Prisma Health, South Carolina's Children's Hospital Collaborative, the children's hospitals, and other agencies and things that are here today. It is my honor to introduce Dr. Edward Simmer, who is the Agency Director for the Department of Public Health. Dr. Simmer, welcome.
Well, good morning, everyone. I'm Dr. Ed Simmer, the Interim Director of the South Carolina Department of Public Health. You may know that we were just created on July 1st of this year from what was the Department of Health and Environmental Control, and we represent all of the health parts of what was DHEC. At DPH, as we're known, we have the South Carolina Cancer Registry, which since 1996 has had all of the cancer cases in the state and information about those, incredibly valuable data to help support those who are treating cancer, working to prevent it, and working all across our state. But despite having that since 1996, this report, which we're talking about today, the 25-year history of childhood cancer in our state, is the first time we've done a comprehensive report about specifically cancer in children. And that's incredibly important because we have more than 200 cases of cancer in children every year. And sadly, an average of about 26 children in South Carolina die from cancer every year. But the positive side of that is that tells you there's also a lot of survivors. A lot of children who, because of the work of places like Prisma and MUSC and McLeod, survive and do well. It is our hope that this report will help encourage more treatment, more planning for childhood cancer moving forward, and make sure there's even more survivors. Because we know that those 300 cancer survivors need support. Not just the medical treatment, as important as that is, and you're going to hear about that, but also psychosocial support. Because there are a few things more difficult, I think, for a child than to hear they have cancer, and for their family to hear, right? That's an incredibly challenging thing for any person, even an adult, to have to face cancer, but imagine it as a child. So this work is incredibly important. I think this report is going to help us do that. You know, our cancer registry is recognized as a gold registry by both the CDC and the National Association of Cancer Registrars. It's also been recognized as a registry of distinction. So I am very proud of the team at DPH that does the incredible work to pull this report together. One of our bureau chiefs who's actually responsible for this report is a cancer childhood survivor herself. And very proud of, again, of the team and all the work that goes into this. But you know, this report is meaningless unless people use it. So we certainly encourage folks to look at it. You can scan this. You can go to our website, dph.sc.gov, and get a copy and use it. You know, I'm about to introduce one of the cancer providers, childhood cancer providers in our state, who uses this information and who makes such a great difference in the lives of children with cancer and their families. So with that, let me introduce Dr. Ann Hoffman. She is the director of the South Carolina Childhood Cancer Task Force and does incredible work making life better for these children and their families. Dr. Hoffman?
Thank you, Dr. Simmer. Thank you all for being here today. As Dr. Simmer said, I'm Dr. Anna Hoffman. I'm a pediatric oncologist at Prisma Health and faculty at our School of Medicine. I'm also the chair of the Childhood Cancer Task Force for South Carolina. Many partners came together to produce this report for South Carolina, and I want to start with them. Those partners included the South Carolina Cancer Alliance, the South Carolina Children's Hospitals, the 3 hospitals that care for childhood cancer in South Carolina, as they mentioned, MUSC, Prisma in the Upstate, and Prisma in the Midlands, the University of South Carolina, and our wonderful South Carolina Central Cancer Registry under the Department of Public Health. We felt, as a task force, that the reason for our work is the patients themselves. And as part of the report, in addition to the data, we wanted to collect the stories of patients and families impacted by childhood cancer in South Carolina. I'll share one of those stories with you today, and I want us all together to remember Colin Roberts. Colin was the child of Tessa Roberts. She's one of our colleagues who works by our side every day. Colin died at 15 years of age from a brain tumor, and he would have been 19 years old this year. Tessa shared with us that she honors his memory and she continues their fight against childhood cancer in her work. Tessa is a research nurse with us, and she enrolls children on clinical trials for pediatric cancer. Colin went through multiple relapses and multiple treatment regimens. He was initially diagnosed as a 2-year-old child, and his mother shared with us that despite all he went through, every day he would have a positive attitude, and that attitude was contagious. She said that Colin would wake up and he would say, "Today I'm going to wake up, I'm going to kick cancer's butt, and I'm going to repeat." That's why we do our work. That's why we're here today. We want to honor all children like Colin who face a diagnosis of childhood cancer in South Carolina. I want to encourage everyone to read the full report available on DPH or the QR code here. Today we'll share 4 things that stood out to us as a task force. The first thing we want to highlight is the tremendous progress South Carolina has made in the fight against childhood cancer. When we looked at children that were diagnosed 2012 to 2016, and we followed those children forward over time, we saw a relative survival of 84% at 5 years. That is really remarkable, and that reflects an 11% improvement in survival over the study period. We saw improved survival for males and females, for children from rural and urban areas, and for 8 of 11 major cancer types. The report shows a lot of good news, and I hope that those who read it will find hope and will feel good about all the work that's been done in South Carolina for childhood cancer already. We also identify areas and priorities that we can continue building on for the future. One of these areas is childhood cancer disparities. That is the second major finding we want to highlight for you today. Though the gaps are narrowing, and we have made progress in this area over time, Black and Hispanic children with cancer still have lower survival estimates than white children with cancer. We also found that these cancer disparities extended into survivorship, with a relatively higher proportion of deaths among Black childhood cancer survivors. We have made progress already in addressing health disparities, but there's still work to do to continue to close these gaps and make sure all children are supported in their cancer journey. The third area we want to highlight for you today is the changing incidence pattern of childhood cancer in South Carolina. We've seen a rise in childhood cancer incidence regionally and nationally, and we see that here in South Carolina as well. Over the study period, we found that the incidence of childhood cancer increased 11%, with similar increases in the region and the nation. The incidence of childhood cancer in South Carolina still remains below the incidence of the region or the nation. We wanted to learn more about this as a task force, So we studied the cancers by cancer type, and we found that the pattern varied depending on the cancer type. For example, we found increasing trends for lymphoma and leukemia and a downtrending rate of brain and central nervous system tumors. Because childhood cancer remains rare, and these changes are also seen nationally, one of the best things we can do to understand these patterns is contribute our data to a national childhood cancer registry. That's something that DPH is working on, and that will allow South Carolina patients and South Carolina data to be reflected in ongoing work to understand these changes nationally over time. The fourth and final area we want to share with you from the report today is survivorship. As Dr. Simmer said, as we know as oncologists, our field advances year after year, and we continue to have more survivors over time, and that is a good thing. We want more childhood cancer survivors. But for a child who's been treated for cancer, the road doesn't end when their treatment ends. They're at risk for late health effects over the lifespan because of the treatments they needed in childhood. And I want to encourage you all to learn more about it by reading Ellie's story in the report. Ellie is 12 and was treated as a young child. Her mom shares how cancer will always be part of their life. Her daughter already required a hip replacement as a result of her cancer treatment at only 12 years of age. To study survivors in South Carolina, we looked at children who had lived 5 years from their cancer diagnosis, and then we followed them forward to learn about their health over time. What we found is that among nearly 3,000 childhood cancer survivors in South Carolina, 5% or 150 patients had already died at an average age of 21 years old. So this shows us the importance of following these children longitudinally over time so we can do preventative care and manage treatment-related complications early. Because of this report, we've identified the longitudinal care of childhood cancer survivors as a priority for children with cancer in South Carolina, and our 3 children's hospitals are working on that issue. So this September, all of you here, in recognition of Childhood Cancer Awareness Month, I encourage you to read our report, to learn about how cancer has impacted your community, people in your neighborhood. We know from the report cancer has impacted every county in South Carolina. This